Hi everybody, thank you for tuning in to this month's What's What talk here at the Mandel Recreation Center. My name is Dan Williams and today we'll be talking about intermittent fasting. So a little overview of what we'll be covering today. We're going to start out just by getting a grasp on the background of intermittent fasting, where it came from, and how it's kind of evolved into how we understand it today. We're going to talk about the physiology of intermittent fasting a little bit, so what's actually occurring within the body when we undergo intermittent fasting. We're going to touch on some applications of intermittent fasting, both medically and in a personal day-to-day type of style. And we're going to finish off by talking about some common myths and frequently asked questions surrounding the realm of intermittent fasting. So beginning with the background, intermittent fasting has been around for quite some time. It's hard to put an exact pin on the first utilization of intermittent fasting, but it's been around at least as long as the days of Hippocrates and his colleagues, and we refer to Hippocrates as the father of modern medicine, so it's kind of a good starting point, if you will, for developing this. But he was around about 460 to 370 BC, so quite a ways back, and during that time, intermittent fasting was viewed as a natural process of the body, more so than something that we intentionally undergo. But it was referred to as kind of a natural cleansing process for a lot of the ill patients that Hippocrates and his colleagues had to deal with. And in fact, intermittent fasting was viewed as such a natural process that even adding food, in their opinion, would exacerbate the illness even more so. And so intermittent fasting was a natural process of cleansing the body that was indicative of the body being in response to whatever the illness is that they were facing. Fast forward to today, and we've gone through a lot of waves of popularity of intermittent fasting and where it's died back off and where it's gained some traction again. But it's a big topic right now, and especially in a time where we're all trying to control our health and what we eat and be conscious of that, which is excellent. But part of the reason for that is because of how available food has become, and on top of that, how addictive it's become. So, of course, back in Hippocrates' time, they didn't have refrigeration, and they didn't have a microwave, and they couldn't eat food 24/7. They couldn't wake up at 3 a.m. and throw some food in the microwave and heat it up and have a late night snack. But now we can, and so our ability to have that access to the food is a lot of the reason why the trends in the United States especially, but globally, are increasing in terms of obesity and overweight individuals. It's a lot to do with the accessibility to food and, again, the addictiveness of it. But if we define intermittent fasting today, we can describe it as voluntarily abstaining from either all or some kinds of foods. In general, with fasting, we're talking about all foods, but in some cases we will include the water, in some cases we exclude water completely. So we'll do this for either dietary, religious, or ethical reasons. However you decide to approach it, intermittent fasting, again, is just abstaining from ingesting food and liquids for a certain period of time. And there's many different ways that you can approach it, so that period of time can vary based on your experience or based on how you want to approach it. But a couple common approaches that we see today, especially the 16 to 8 is one of them. So that's essentially window eating, so eating within just a specified time period. So 16-8 we're referred to being fasted for 16 hours of the day, and then having an 8-hour window that we can eat. So a lot of this comes in the form of, say, just cutting out breakfast is a popular version of it, and then just having between the hours of, say, 12 and 8 to eat. That's what we refer to as 16 to 8 or intermittent window eating. And this can be in the version of 18-6, it can be in 24, so whatever the hours are that you decide to not eat and decide to eat, but that'll be a very consistent day-to-day regimen. We also have alternate day fasting that is tried out by many people, as well as 5-2 days, which both of these are taking an entire day and just not ingesting any foods or liquids for that entire day. Alternate day is, of course, staggering days that you eat with days that you don't eat. And then 5-2 is 5 days of the week eating with still a controlled calorie intake, but having 2 days of that week that are just absolved of all food. So talking about the physiology of intermittent fasting, so again, what's actually occurring in the body. If we were to summarize this in just one sentence, we could refer to it as a metabolic shift in our energy utilization, going from glucose as a primary energy source into fatty acid oxidation. But there's a lot more that's going on beyond that just one sentence. So in the early stages of intermittent fasting, what we would expect is our liver to be clearing out all the stored glycogen that has been accumulated within it. And this can take up to 24 hours, give or take, but the liver is going to store all of that extra glycogen that we are normally using and converting into glucose to use as energy. So during those first 24 hours of course, not ingesting food, is when that liver is going to be clearing out or utilizing the remainder of that stored glycogen. This might be when we see what we can refer to as a rapid weight loss because we're using all that energy and of course not taking excess energy in. So whenever there's more calories being burned than there's calories being ingested, we can expect a degree of weight loss. However, this can also be in part due to being in a negative sodium balance, which we refer to water loss. So we're losing some of that water weight that we would carry around on us. During this time, there's going to be a high rate of gluconeogenesis, which is just converting anything that's not glucose into glucose for the utilization purposes and burning that energy. As this progresses, so going through those 24 hours, we progress into ketosis a little bit more so, and this is not just an immediate flip of the switch, it's a gradual process where we use both glucose and fatty acids, and over time they sort of invert, if you will, in terms of what's being more dominant, but we progress into that ketosis over time and use those fatty acid stores more so than the stored glucose, of course, as those glucose stores are being deplenished. Eventually, those rising ketone levels take over entirely for glucose, or for the most part, not completely entirely, but in a dominant sense, they take over for glucose utilization and become the primary energy source. This decreases the gluconeogenesis and spares some of that protein catabolism, so we're not going to have as much muscle wasting and breakdown of what we want to be storing in the form of amino acids. So there's many applications for intermittent fasting. The most common thought of and utilized is for weight management. And it's important to distinguish weight management and weight loss because weight management is of course more broad than that. Intermittent fasting does not inherently imply weight loss. It just means that you're controlling when you're eating and when you're not. So it may lead to weight loss if that's what you're intending for to do, but that also is accompanied by being in a caloric deficit, which might be easier for you if you're intermittent fasting. However, it's not the absolute. So again, weight management being separate from weight loss, although weight loss might be what the goal is with intermittent fasting. So it depends how you manage those calories. However, medically, there's lots of different uses for it. Intermittent fasting is in large part suggested for type 2 diabetics. These are the insulin-resistant diabetics, and the reason that this is so applied to type 2 diabetics is because the effects of intermittent fasting directly go against what a insulin insensitive person might be experiencing. So with the characterization of insulin resistance and impaired glucose utilization, that's exactly what intermittent fasting would be aiming to reverse. So it's very helpful for type 2 diabetics. Along with that, a couple other options up here, hypertension and non-alcoholic fatty liver disease, are both going to be influenced by weight management as well. So being overweight is going to be a factor for being hypertensive or having that non-alcoholic fatty liver disease. And so managing that weight possibly through intermittent fasting could be an advantage that you could use. Cognitive function is a fairly interesting one. It's something that's been speculated of, but unfortunately the research is a little bit unclear about that. There's just some more research that needs to be done in this area. But there are definitely reports of mood being improved, depression and anxiety, two of them that are focused on. So although it may not be a direct improvement in cognitive function in terms of thinking clearly or whatever you have it'll be a little anecdotal there. But improving mood and anxiety are two aspects of cognitive function that might be influenced by intermittent fasting. Epilepsy is one that has received a lot of attention, and epilepsy was first being treated with a ketogenic diet, and that's sort of where intermittent fasting has picked up and run from. And so we're seeing that ketogenic diet is actually very influential in a positive way for people with epilepsy in terms of reducing seizure frequency, as well as delaying the onset of the first seizure from the time of a given meal. And so with that in mind, using the ketogenic diet, there's research being done with intermittent fasting and finding somewhat similar results, and that individuals, and especially kids with epilepsy, are benefiting from that window time restricted eating and having the benefits from intermittent fasting. So it's excellent that they're having that benefit and encouraging for future research with epilepsy. Longevity is another kind of unclear section of the research for intermittent fasting, but there are speculations that intermittent fasting will improve your lifespan. And of course, if you're managing your weight and managing your health and all of those factors come together, then we will have a higher quality of life and possibly improve our lifespan and increase that. By how much, it's unclear, and how effective if you were solely intermittent fasting versus having a total healthy approach to your life. That discrepancy is a little bit unclear. But again, it's the cumulative effect that intermittent fasting might play into that can increase longevity. Circadian rhythms. So of course, our hormones are going to fluctuate throughout the day, and intermittent fasting and feeding in general is going to have an influence on what spikes at what times and what doesn't. So of course, insulin will be one of the primary aspects affected with its rhythm and intermittent fasting, as insulin spikes whenever we have food ingested and is highest at the beginning of the day. So if we implement intermittent fasting, that might affect how that insulin is spiking throughout the day, or when we're deciding, if it's going to spike at a given time, or if we want to delay that rhythm. But a asterisk with circadian rhythm. So when we think of circadian rhythm, at least personally, I think of sleep right away and melatonin. But it was found that melatonin is not really influenced by intermittent fasting. It's more influenced by light-dark cycles. So that's one area and one rhythm that's not really affected as much as insulin, and cortisol is another one that would be. Alzheimer's disease. So intermittent fasting may have some impact. There's been some studies that show promise in mouse models, but then again, there's some studies that don't show the same reassurance. And so the findings are a little too inconsistent to be promising with the Alzheimer's right now. However, there are some components that do show promise, and especially with the accumulation of beta amyloid plaques in the brain. And so it seems that there may be a positive effect on the accumulation from intermittent fasting, in a sense that it would reduce that accumulation. However, more research is still needed, but possibly an area that intermittent fasting might show benefit for. Multiple sclerosis is, again, promising in mouse models, but something that needs more research. However, diabetes and hyperlipidemia are associated with MS, and so attenuating those might help, and that can also be a downstream effect of intermittent fasting. Tumor reduction, this is one area that has shown promise, as well as cancer. However, it's not cut and dry, it's not white and black with this. Some cancers seem to have more of a response to intermittent fasting than others. And so if this is an area that you are dealing with, tumors and cancer, then I would suggest that you talk with your primary care physician or your doctor and ask if your specific cancer would potentially benefit from intermittent fasting. But there might be that possibility. There's been signs of reductions in lymphomas in mouse models, and so there's definitely more area to do research for these categories. And the side effect of that is, or a side note rather, is someone undergoing cancer treatments, right? Chemotherapy, radiation. That's obviously a very demanding process as well. And it has been shown that intermittent fasting has helped kind of mitigate some of those side effects. So even if it's not having a direct effect on tumor reduction or cancer treatment, it might help mitigate, again, those effects of chemotherapy and radiation that would go along with these conditions. And finally, age-related frailty. This is another one that is a little bit speculative, but because of our energy demands shifting as we get older, intermittent fasting might be beneficial in a term of increasing the autophagy and cell repair within the body, and managing again when we are eating and that we're not gaining weight because we become less active as we age. So lots of uses for intermittent fasting. If you do have one of those conditions, I would encourage you to speak with your doctor about it and see if that might be a appropriate approach for you in treating your ailment. So, some common myths and frequently asked questions about intermittent fasting. The first one is, aren't you just starving yourself? Will I be hungry all the time? The answer to this, maybe. It's not necessarily starving yourself, but odds are there's going to be a bit of a learning curve for you. However, that's the benefit of intermittent fasting and its many forms, is that you don't have to just jump right in to a 24-hour fast. You can start out with that time-restricted eating and kind of work your way into it and see what patterns work for you. Reports through studies of intermittent fasting thankfully have shown adherence is very high in the most part, and it's promising that it's not really that daunting of intermittent fasting. I've personally done it many times myself, so there's a slight learning curve, but nothing that you can't handle. Fasted exercise, this is a big topic about it. Should I do fasted cardio? Will I burn extra fat? Will I lose muscle? These are all questions floating around intermittent fasting and exercise. Unfortunately, it does not show really that there's additional benefit from doing cardio and burning fat when you're fasted versus fed. So go ahead and have those carbs in the morning, burn that energy, or fats if you're on a keto diet, but go ahead and have a little bit of something before you do your morning cardio. And going along with that, if you are doing fasted exercise, maybe take it a little bit easy during those exercises, or at least make sure you're staying hydrated and be aware of the intensity that you're working at so that you're not becoming lightheaded or dizzy or anything like that. We of course want to avoid any negative side effects of being fasted or having low blood sugar. Lean mass, thankfully muscle, does not appear to be lost under normal conditions. So unless we're in an extreme fast, we seem like we'll be able to maintain that muscle just fine, which is a good sign for all my strength training enthusiasts. How do I break a fast, and will coffee break my fast? Two questions that kind of go hand in hand. So how to break a fast, the best way is something that's going to be easily digestible. A lot of recommendations go along with bone broth, apple cider vinegar, and then depending how it agrees with your body, chicken, fish, avocado. They might be something that you can look at, but really whatever is going to be easy to digest for you and something that you can take in and not feel like it's going to be weighing you down right after you eat it. Coffee and tea without sweeteners, safe to drink, and they will not break your fast. Very, very low calorie and safe to drink without worrying about going out of ketosis. Adherence and calorie compensation, the final myth. These are both going to be dependent on the individual. So adherence, of course, is an unfortunate downfall of diets, if you will. Adherence is typically not very high, regardless of the diet. And so being able to stick with intermittent fasting is a worry for some people. However, in a sense, intermittent fasting gives you that advantage of not necessarily needing to adhere it quite the same as, say, if you're doing a ketogenic diet, because it's not restricting you from eating specific foods. It's just saying you can't eat them during these times. So adherence does seem to be a little bit higher for intermittent fasting versus specific food type diets. But calorie compensation is something to also be aware of if you are doing intermittent fasting for the sake of losing weight. Because it's very easy to say, I'm only going to eat between these hours and not eat during these hours to lose weight, but during the time that you're eating, you eat just as many calories as you would have if you were eating over a longer period. So still something to be aware of, but dependent on the individual, certainly. So finally, is intermittent fasting right for you? Well, the answer is it depends, of course. So what are your goals, right? What is your lifestyle? Do you have religious considerations? All of these things are going to be factors in terms of, is intermittent fasting the right decision for you? And furthermore, what type of intermittent fasting? Should I do the 16-8? Should I do alternate day? It depends on what your goals are. Are you active throughout the day, right? If maybe if you know you're not active in the morning, then you can do intermittent fasting in that sense and cut out that breakfast, which is a traditional approach. But if you know you're going to work out in the morning, maybe you don't have that fast with skipping the meal, and you maybe start your fast by having your last meal of the day a little bit earlier and having that 16-8 window shifted. It's however you approach it, and it's however it can be sculpted to fit your needs, and if you even need to do intermittent fasting, period. But it's safe to try. The only consequence is that you might be hungry, in which case you can just eat something. So very low risk, and we've seen a lot of the benefits and potential positive effects that it can have on the body. So to leave you with a couple of tips for success, eat nutrient-dense foods, right? Don't fill yourself up with empty calories, right? Eat foods that you know are going to be satiating, high in protein content, and that are going to keep you from being hungry during those non-feeding hours. Plan meals ahead of time is another good one, so we're not scavenging for food last minute, saying, oh, I only have 30 minutes left to eat, what am I going to get real quick before I go on a fast, right? Plan those meals ahead, know that you have a structured plan, and that you have this meal that's going to keep you full during, again, those unfed periods. Don't be overly critical of yourself, right? Again, we can think of it, I guess, as guidelines more so than a strict diet regimen where you can't eat a single carb, or you can only, you can't eat a certain food or drink a certain liquid. Intermittent fasting, again, is based on the time that you're eating. So if you happen to break the fast, worst thing that happens is you have to start the fast over. But don't be overly critical of yourself, because sometimes you get hungry and it's best just to get something down, right? We have to cure that craving to an extent, but differentiate when it's just a craving and when you're actually hungry, and that it'll help you along the way. And finally, stay hydrated. Of course, we're already depriving ourselves of a lot of important nutrients for a certain period of time, so we don't want to be dehydrated on top of that. Being full with water will help retain a little bit of that weight, so we're not walking around feeling frail. But all of these things together can help you be successful with your intermittent fasting. So thank you for watching this intermittent fasting presentation. I know it was a long one, a lot of information coming at you. If you do have any questions, feel free to reach out to me personally via email. My email is right here on the screen, dwilliams@townofpalmbeach.com. I'd be happy to talk with you. Any questions, concerns that you have about intermittent fasting, I'm happy to be here and a resource for you. Our next What's What will be on going green, so we hope that you will be able to tune in for that. And with that last tongue twister, have a great rest of your day.